Hello, my name is Ayesha Bradley. I'm a Uro-oncology Specialist nurse here at University Hospitals Plymouth, and I'm part of the team looking after you for your prostate cancer. It's very likely that you have been prescribed some form of hormone treatment to help manage your prostate cancer. These hormone treatments lower the amount of testosterone in your body. Unfortunately, by doing that, we can often create some bothersome side effects. Side effects would include increased fatigue, weight gain, loss of muscle mass and muscle strength. It can lead to hot flushes and night sweats. This in turn might lead to anxiety and sleeplessness. One thing that we know that can help manage most of these side effects is actually doing daily exercise. Now, although the UK don't have any specific exercises recommended for men with prostate cancer, most doctors would agree that following the Department of Health guidelines is the way forward. So the guidelines suggest that you need to do at least 2.5 hours of moderate exercise a week. Now, moderate exercise includes things like mowing the lawn or brisk walking. It's an exercise that you can do and still be able to form a sentence without having to stop and start. Alternatively, you can do 75 minutes of vigorous exercise. So this would be your running, your jogging, maybe some energetic dancing. When you're doing vigorous exercises, you're probably more likely to need to stop and start because you're breathing quite hard. Government guidelines would also suggest trying to do some weight-bearing exercises at least twice a week. Weight-bearing exercises are things like using your own body weight, so climbing the stairs, or alternatively, it could be carrying heavy shopping. If you've got bone metastases, weight-bearing exercises are important, but you need to be a little bit more cautious and a bit more gentle with yourself. So maybe focus more on doing some climbing the stairs or doing some exercises in the pool. So how do you get started with any of this? For many people, walking daily is part of their natural routine, and that's terrific. All we want you to do is move a little and in time, move more. So what we've done to help is create a 15-minute video targeted at men with prostate cancer that have little or no experience of exercises. We know it's really overwhelming when people say to you, you need to exercise, you need to get moving. But for many of us, we don't really know what that means. We're hoping that this 15-minute video will inspire you to get started. It's involving exercises that are based in the chair, then standing up and using a chair, and then actually using some household items so that you don't need to be going to the gym, you don't need to be leaving your home. And we feel this is particularly important as we are coping with COVID-19 at the moment. What we'd like to achieve is inspiring you to get moving, because we know by moving a little every day, we can help manage some of those bothersome and troublesome side effects caused by the treatments that we're giving you.